Hi, and welcome to the Public Health Lab at Clemson University. My name is Meredith Riak, and I'm one of two health fitness assessment interns here under Dr. Karen Kemper. Today we're going to be giving you a virtual tour of the lab using some pictures and descriptions of what each piece of equipment does.
This first piece of equipment is our treadmill, and we use this to conduct cardiorespiratory fitness testing to estimate VO2 max. It's a progressive workload test, and we use a constant speed, 3.4 miles per hour, with an increasing incline over 3-minute increments. Secondly, we have our cycloergometer, or the bike. This piece of equipment is also used in cardiorespiratory fitness testing to estimate VO2 max. The client will keep a set pace of 100 beats per minute, and after each increment of 3 minutes, the resistance on the bike will increase by a set amount depending on the client's heart rate in kilopounds. So this is also a progressive workload test. Now both of these tests are submaximal tests, which means that we don't take the client to over 85% of their max heart rate. And to monitor that, we use this heart rate monitor and receiver. The gel pictured here is put on the heart rate monitor so that the heart rate monitor and receiver can read the heart rate correctly. It's important that a female client doesn't wear an underwire bra because it could also interfere with the receiving of the signal. Another test that we use for cardiorespiratory fitness testing is the YMCA step test. In this test, there's a 12-inch bench that the client will step on and off of at a rate of 96 beats per minute. This test measures recovery heart rate. The fourth and final measure of cardiorespiratory fitness is the Rockport 1 mile walk test. The client will walk 1 mile over a flat surface and can use sticks like these to keep track of how far they've walked. For every lap of a building or length of a hallway, the client would hand one stick to their tester. After walking 1 mile, the client's 30-second heart rate will be taken. This is a self-paced workload test. One piece of equipment that we use for all of these tests is the stopwatch pictured here. And in our bike test and our step test, we use this metronome to keep the pace. In the bike test, the pace is 100 beats per minute, and in the step, it is 96 beats per minute. Another test which uses the metronome is the sit-up test, which assesses muscular strength and endurance. The client will lie on this mat with their fingers at the edge of the first piece of tape and will curl up until their fingers reach the second piece of tape at 8 centimeters away. The maximum number of sit-ups the client should do is 75. The tester should hold the client's head so that their neck muscles do not tire before their abdominal muscles. This same mat is used when measuring flexibility. The client will lie on the mat and the tester will use the goniometer, pictured here, to measure the angle of flexion at the hip or at the shoulder. To clean the mat or any of the other equipment in the lab, we use Cavicide antibacterial cleaner. Simply spray the Cavicide on a paper towel and wipe down the equipment. To clean smaller pieces of equipment, you would use these alcohol pads. These can be used to clean a stethoscope or a blood pressure cuff. We have two different types of stethoscopes in the lab. The single you've probably seen at the doctor's office or the hospital. But the learning you may not have seen. We have two earpieces on the learning stethoscope so that the student and the instructor can both hear the blood pressure or the heart rate. To measure blood pressure manually, we would use this sphygmomanometer or blood pressure cuff. After palpating the systolic pressure, the tester would pump up the cuff to 30 millimeters of mercury greater than the systolic, or to 200 millimeters of mercury in young, healthy individuals. After palpating the systolic pressure, the tester would pump up the cuff to 30 millimeters of mercury greater than the systolic, or to 200 millimeters of mercury in young, healthy individuals. You would then slowly let air out of the cuff, listening for the first and last heartbeat. The pressure indicated on the dial at the first beat is the systolic pressure. The pressure indicated on the dial at the last beat is the diastolic pressure. You can also measure blood pressure automatically using this automatic sphygmomanometer. You simply wrap the cuff around the arm just as you would with a manual cuff and press a button, and voila, you have your blood pressure. These machines are much easier to use, however, they are often less accurate than a manual blood pressure cuff. Switching gears a bit, we're now going to talk about some of the equipment that we use to measure body composition. First, we have our stadiometer and scale. These measure height and weight. When measuring height, you want the client to have their shoes off and remove any extra clothing and face away from the scale, standing up as tall as they can. You can use the Frankfurt plane to ensure that their head is at the right level. In measuring both height and weight, if the scale falls between two numbers, then you always round down. When measuring weight especially, you want to be sensitive to the client. There's a privacy screen in the room that you can use, and also if the client would choose not to see their weight, you can have them face away from the scale. Also, when measuring weight, you want to start off close to a number that they've reported to you. Now, once you have these two measures, you can plug them into a formula to find their rating on the BMI scale, or the Body Mass Index scale. This is one way of measuring body composition. However, it is not the preferred method because it does not take into account the weight of muscle versus the weight of adipose tissue. The next measure of body composition that we have is waist circumference. And to measure this, we use a flexible measuring tape, such as the one pictured here. To measure, we find the top of the iliac crest, or the top of the hip bone. It's important to note that this is not the anterior portion of the hip bone, but rather the top. Once we find the top of the iliac crest, we'll ask the client to hold the beginning of the tape on that spot and ask them to turn to the side on which they are holding it. This is so that we don't have to reach around the client, making them feel quite awkward. You want to make sure that the tape is parallel to the floor, and you can take the reading in either inches or centimeters. Our final measure of body composition are the skin folds, and we use these to find body density using a formula, usually with 3 or 7 sites all around the body. And from finding body density, we can find percent body fat. The most common sites in a man are the chest, subscapular, and the tricep measure. In a woman, the most common sites are the tricep, the thigh, and the suprailiac measure. We use the skin fold calipers here to pinch a portion of the skin containing the subcutaneous fat. It's important to only get fat and not to pull muscle, as this will greatly alter the measurements. To ensure that we're only getting fat, you usually will push into their skin and then pull back the portion. Muscle does not come up easily. When we measure skin folds at a specific site, we'll use stickers like these to mark where that site is. Usually we'll be measuring halfway between 2 points on the body. For example, when you measure the tricep, you're measuring halfway between the acromion and the bend of the elbow on the back side of the arm. Using stickers to mark your spot will help somebody who is measuring for the first time to remember where the spot is. It's important for the tester to remember to pinch 1 to 2 inches above or below the sticker, but to take their actual measurement at the same level as the sticker. One other type of assessment that we have our students perform is a posture assessment. To perform this, they use a plumb line, mirror, and posture chart. The posture assessment can point out any imbalances in the body. Several examples of these are lordosis and kyphosis. One machine that is new to our lab is the oxygen analyzer. This machine is used to measure oxygen consumption through analyzing the amount of oxygen expired into the machine. It can also be used to assess resting metabolic rate and VO2 max. The last piece of equipment we're going to be showing you today is the arm ergometer. This is a very new piece of equipment in our lab, and we are hoping to use it in the future to test VO2 max of the physically disabled. Though as of right now, we do not have any set protocols on how to do so. Well, I thank you for taking the time to watch this virtual tour. I hope it has helped you in learning about our public health lab here at Clemson. And if you are considering attending Clemson, I hope that this will persuade you. If you have any questions about the public health lab, you can contact Kathy Meyer at kathm@clemson.edu or Dr. Karen Kemper at kkaren@clemson.edu.